very little NICU information is given to doulas, even though doulas are the boots on the ground support for families throughout the trajectory of pregnancy, birth, postpartum, and beyond. And so by not having this information, we're basically gatekeeping doula care from NICU families, which is just, these are the people that truly need this type of support the most.
Hello, and welcome back to another episode of the Birth Lounge podcast. Are you a doula that is striving to be evidence-based? Are you kind of confused and overwhelmed and not really that sure about where to start to find the evidence-based information? And then when you do, you find yourself rabbit holing, and then there goes 3 hours of your time. And then you're like, oh my gosh, how am I going to compile this stuff for my clients in a concise way that is easy for them to digest? Well, let me introduce you to the Birth Lounge app. Not only is it great for you because it will break down exactly what the evidence says on so many topics that your clients are asking you about, but it's also awesome for your clients. You will be able to direct them to specific articles so that they can find the information that they should be asking their provider about. Plus, it will guide them through questions that they can actually take into their prenatal appointment and have a discussion informed and confidently with their doctor or their midwife or their GP about the things that they need to be discussing truly before labor starts. You and I both know that when you're in labor, it's kind of too late, right? We don't want our clients to be having these really deep discussions with their providers while they're also, contracting and trying to push out a baby. At that time, it's a little bit, let's just say we want them focused on their body and their baby. The best time for them to be having these discussions are prenatally. So one of the tools that you can use to properly equip your clients to not only make their birth better and to help them be more educated and informed, but ultimately to make your job as their doula easier is to direct them to the Birth Lounge app. This is an app that is designed for moms and dads and grandparents and doulas to help you help your clients navigate the hospital system. It's going to give you weekly updates on exactly what's happening in your client's body and with their baby's development. And again, all of the data is going to be at your fingertips, clickable links, digestible articles, and questions that you can use to help your clients have their best birth possible. It's made for iPhone, iOS, and Android. So head to your respective app store right now, search the Birth Lounge app, and I cannot wait to see you in there. Bye. All right, you guys, let's get to a continuation of Wednesday's episode. So Wednesday's episode was all about navigating the NICU as a parent or a grandparent. So if you haven't listened to that, go back and listen to that. It lays out beautifully exactly what families can expect when the NICU is part of their story, including questions they can ask, the machinery they're going to see, and the faces that they're going to meet. But as a doula, you probably, if you haven't already, you will eventually have a baby that's in the NICU. And at that point, a lot of us are stuck questioning, well, what is my role? Do I continue to support this family? Do I let the NICU staff just take over? If I am meant to continue to support them, how do I do that? Am I even allowed in the NICU? What kind of boundaries and role can I play now that their story has shifted quite drastically? On Wednesday, you met Mary Farrelly, and she's back again today. Mary is a really good friend of mine, a NICU nurse, a doula, and an educator who helps bridge the gap between families and the NICU with evidence based, empowering support. Now you know why I love her so much. Mary is also the creator of the NICU Doula Academy, which is a certification program that trains doulas and perinatal health professionals in a trauma informed, NICU-specific way. I love Mary's mission so much, which she describes as she wants to create more joy and less trauma in the NICU experience. That's so beautiful. If you've been in birth work more than 2.7 seconds, then you know that so many NICU families feel forgotten. They feel like the NICU is a little corner of maternity care that doesn't get a lot of attention. And quite frankly, once you leave the NICU, there's not a lot of support out there of how do you transition home? What does home life look like now? Even though your baby is quote unquote graduated the NICU, they're still quite fragile. Mary and I both believe that this is a really unique place that doulas can step up to fully support families as they begin their life outside of the NICU. In today's episode, we're going to talk about how can a doula fit in to the NICU experience. How does a doula best communicate with a NICU team without overstepping or creating friction? What's the most helpful thing that you can do as a doula for a NICU family? What kind of emotional challenges can you expect your clients to experience while they're navigating the NICU? And then also, how can you help explain medical procedures, the equipment that they are surrounded by, and the faces that they are going to meet? Plus, how can you help them come up with questions to ask their NICU team so that they can remain in control not only of the decisions, but in control of all of the discussion that is happening around them? Because one of the things that you and I both know as a doula is so many times within the medical system, patients feel as if their medical team is talking around them or at them, but not truly with them. Mary and I are going to talk to you about exactly how you can facilitate deep, connected discussion between your clients in the NICU and their clinical staff. If you are a birth worker of any kind and you have any interactions or support new families in any way, this is an episode that's going to completely change your practice. We are going to equip you to not only understand what the NICU is like and what your role there can be, but how you can fully show up for your clients to help improve their outcomes and their experience if the NICU is part of their story. So without further ado, Mary, welcome back.
Glad to be back.
I'm so excited for this conversation. I think last time was really powerful, and we gave parents a lot of good information and tips and education around the control that they have in the NICU. But as a doula, obviously, I would be remiss if I left us out of this conversation. And as a doula who has supported people for the last decade, I obviously have had my fair share of NICU families, whether it was expected, most of the time unexpected. As a doula, our role changes completely when a family enters the NICU. And I was sharing before we started recording, whether it be our own perception as a doula or a true kind of tension, sometimes it can feel as if we are a burden, as if we don't have a place in the NICU. And then I think that there are some doulas out there who are so unfamiliar with the NICU that they actually get stuck in this fight or flight, and it's more that they are stuck in frozen mode and they don't know how to proceed. They don't know what to say. What is my role? I don't really know how to step you through this. And so in those cases, they're either unhelpful or they say nothing. And that can sometimes make that family feel abandoned, which obviously is none of our goals. And it's so unintentional. And so today's episode is all going to be about how can doulas support families in the NICU, and what do doulas need to know about the operational side of a NICU, because it is very, very different from L&D and even postpartum floors. So, a good place to start, I think, is maybe setting the stage. We all know what our role is in L&D. We all know what our role is in postpartum. We even probably know our role in the OR. But what is our role when a family enters the NICU, and how does that change for us as doulas?
Yeah, you're right. As I see, doulas are either in one of two camps. They are so overwhelmed by what they don't know that they are so scared to say the wrong thing that they turn away, or they feel like they have to be physically present in the NICU at the side of the family in order to be making a difference. When the NICU is part of a story, one of the things that happens to families that we touched on in the last week is that it can both feel incredibly emotionally overwhelming, practically and logistically intense, and the family's physical and other needs just go out the window for the family's care. So the doula's role really becomes this behind the scenes place of refuge and support so that the family can then step into the role of autonomous and advocacy parenting in the NICU. Because in the NICU, the family really sometimes can feel like the second part of the care team. They're not the priority. The family can feel like the NICU nurse gets to do all the hands-on care and all the things, and that they're just observing. So sometimes what a doula can do is we feel like we want to step in and do hands-on care, but really what we need to do is make sure the family is in a mental and physical place to be able to do the hands-on care for their baby themselves. So that is really where the doula can shine, is seeing the gaps in where the families need that physical support, because especially physical postpartum health, nutrition, and healing is really not prioritized by the family or thought about it. Helping families support their feeding goals and really just being that steady emotional presence that a lot of NICU families are missing. So you don't have to know everything. You don't need to be a complete, you don't need to know every detail about NICU care to be able to show up for a NICU family in a way that feels so impactful on how that NICU experience is going to impact their whole rest of their parenting journey.
So, what does that look like? Are you just sending a text every morning or every couple days to say, hey, checking in and getting updates? No need to text back if today's really busy, just send in my love. Is it simply sending a text every day at 2 p.m. to say, hey, Jan, just wanted to make sure you've eaten something today. I'm in the area and would love to run by lunch if you are in the area, or just simply checking in and saying, hey, just wanting to let you know I'm thinking about you and I love you. And if you haven't drank any water, it is 12:30, so have a sip of water. What does that actually look like?
That's a great question. It's going to look very different for each family because when each family is in a crisis mode, they're going to want and need different things. Some NICU families may want your physical presence. They may want someone that they trust to be able to maybe sit in the room if that's something that is allowed in the NICU, and we'll kind of touch into that too, and be physically present with the baby so they can go and pump and take a nap. They may want someone who is just touching base, and that is something that anyone could do. Most NICU families can feel incredibly overwhelmed by feeling the need to update people. So there's ones like, how's the baby? How's the baby? How's it going? And you're just like, I just want to be in my nest and just I can only handle this one thing right now. So even just saying, hey, I'm here for you, I'm listening, I'm present, but also families don't know what they need and they don't know how to ask for it. So when I hear from NICU families, this is a lot, is they wish that they had people offering tangible support. So instead of saying, let me know if you need help, or how can I help you, saying, I made you a batch of chicken noodle soup. I can bring it by the hospital at 2 p.m. I would love to meet you in the lobby. I have a bag of postpartum supplies and snacks. If you can't make it down there, that's fine. I'll bring it up and leave it wherever it is. The biggest love language that you can give to a postpartum family and a NICU family can be the physical care of food and nutrition because hospital food is not it. You're not going home and no one's feeding you breakfast in bed when you're in the NICU. So if you can recreate some of those holistic postpartum things that we're so good at as doulas, as much as you can within the NICU setting, can be such a gift to do. It can be as simple as bringing food. It can be as simple as a text message or offering, if that is something that feels aligned to the baby or to the family, helping with some of those like logistical things within the NICU, but also connecting with resources to be able to allow their life to go on at home. So a lot of times the NICU baby is not necessarily the family's only baby. And people who are only child and people who are like a loved one of the family, they're also experiencing a feeling of crisis or trauma as well because their child, who is now the parent, is going through something. So they're them as a parent of their child or as a friend or loved one, it's sometimes hard to organize and help support the family in that way. So doulas I've seen, again, this is depending on your capacity as a doula also, and what the family needs, be able to help set up a point person or a way to create updates, a resource like supportnow.org, which is like a place where you can have one area where people can sign up for dog walking or watering plants or monetary donations if that's something the family needs to support their medical bills or a meal train. It's all in one spot. And sometimes just having someone like a doula be like, here's this resource, I'll help you set it up. And now, grandma has this place to go and set and keep things going. That can be a gift too. Just being able to take away some of that burden. But the other place where doula can really shine is emotional processing. So you've already formed this relationship with a family. They've picked you, they trust you, they know they've invited you into this really safe space that might be their birth or postpartum experience without the NICU. So sometimes families need that safe person to be able to share their more almost like ugly feelings, for lack of a better word. Sometimes in the NICU, what people will say is all these toxic positivity. Like at least the baby's in a good NICU. At least you get to go home and spend the night. At least this, at least that is the worst thing that you can say to a NICU family because it feels like they're not allowed to feel angry, sad, real grief about their experience. Sometimes a doula just saying, taking the temperature of a family, how are you feeling today? Or do you want to celebrate a win? What's your joy? Or do you want, I'm here to listen if you want to vent really and share. I'm here to listen non-judgmentally and not replace it with feelings of you should feel grateful. Like the family can feel both. Family NICU families are feeling joy and grief simultaneously all the time. They're so excited to meet their baby. They're so happy that they're here and they're alive and they're making milestones to home, but they're still grieving the loss of what they thought their birth was going to look like, what they thought their postpartum experience was going to look like. So knowing that and being able to meet families where they're at emotionally is also an incredibly powerful gift that a doula can offer.
And it takes that doula being in a certain place in their own life, in their own emotional intelligence, in their own healing journey to be able to hold that space, to be able to show up for families in that way and to not use those dismissive, although unintentionally, dismissive phrases in terms of at least, right? It's the same way that we try and comfort people who are facing fertility challenges, not realizing that while we say it out of love, it lands very differently and feels really harsh. And so I think that as a doula, I love you guys, and I always will tell you the truth. You have a responsibility to do this work. And if you can't do this, you should be upfront with families and you should say, now that you're in the NICU, it changes my role a little bit. I want to introduce you to someone else who can. I want to introduce you to this resource. But you being able to not only acknowledge the places that you are not able to support this family, but also hand them off to someone who is without your ego getting in the way is going to fare better for your family. And ultimately, I know that we're all here to serve our families and to improve their outcomes. So just sit with yourself and do this work and be really upfront with yourself about the places that you still need to maybe face yourself or look in the mirror or do some growth because I know that you would never want to be the person that caused additional trauma by the things that you say. And I know that's never any of our intentions, but we can sometimes do that if we haven't sat with ourselves and looked in the mirror.
The NICU can when I worked with doulas who are working with NICU families, the NICU can be very triggering for them for two different pathways. They can feel like, in a way, similar to the families feeling grief, they can feel like they failed their family, that they didn't deliver on this experience that they hired them to give, which we know is not the right way to think about it, that we're not in control of our clients' outcomes, that birth is unpredictable, and that the NICU is there as a resource and is not a sign that you failed or that your body failed or your client's body failed. But it can, sometimes I feel like doulas can feel like they are stepping back because they have their own feelings of guilt or grief or whatever that may be. And then they also, it is as you said, it's a different medical setting. It can be triggering if you have your own past medical trauma, which a lot of times I feel like doulas get into doula work because of something that happened to them that they don't want to happen to other people. It's either like you become a doula either because you had the most incredible, empowering birth and postpartum experience and you want to recreate that for other people, or the opposite happened and you want to protect them. So I see doulas get into, we talk about this in one of my courses, there's something called the drama triangle. You ever heard of that? So
No.
it's a psychological concept where, and you can see it play out in not just a doula scenario, but I see it when I learned about it, I was like, oh, this is very interesting for my personal life. But in the drama triangle, there's a hero, a victim, and then there is a challenger. So in this scenario, the victim might be the NICU family. The challenger is the healthcare system and the NICU experience. And so doulas can feel like they need to be the hero. They need to step in, they need to fix it, they need to make the bad go away. Whereas the flip side, the good version of the drama triangle, but with this, the bad version makes the victim feel like they don't have any power. They don't have the skills to be able to overcome this challenge themselves. Whereas in the flip side of the drama triangle, the hero instead, the doula becomes a coach. And then the victim becomes someone who's overcoming a challenge, who can get through it. And then the challenge itself, instead of being this like kind of persecutor, it just becomes a path for the person who's going through the challenge to step into this role and go through the journey, kind of like you have to go through labor, and then the doula remains the coach. But I feel like lots of times in labor, the doula can remember that and stay in that role. But when something, quote, bad happens or changes, we, by the definition of who becomes doulas, flip into hero mode and feel like we need to step in and either fix everything or you go into that flight mode and freeze and you just back up and you're like, I don't have my hero skills, so I don't know how to help or fix this situation, so I'll just leave it. But that's just some interesting insight that helped reframe how I work with families, both as a nurse and a doula. I always remember I'm not the hero, I'm the coach. And they're not a victim, they're someone overcoming and getting through a challenge. And if I fix it for them, then I take away their power and their ability to look back on their experience and be like, I did this, I got through this myself with help, with support, with love, but I am a powerful person. And I do see that with NICU families that have support throughout their NICU stay, they come out of it on the other side so strong. Like they're fierce families. They are incredible advocates. They want to step forward and give, basically pay it forward to people who went through the NICU and they look behind and they like want to pull the families that are in the trenches along with them and hold their hand through it too. So that is just a framework that helped me when I was stepping into this work as well.
Okay, I want to dive into this because listeners, you guys know that I neither got into this industry for a good birth nor a bad birth. I got into it because I had this unique insight into the medical system, thanks to Mr. HeHe being in the healthcare system. And I was doing advocacy work in the educational system, which is parallel to our medical system in the US. And so I was just like this kind of unique unicorn vigilante where I was like, wait a minute, we've got some work here to do, and I think I can be the one to do it. And so, with that drama triangle and these unique perspectives that I have, automatically I can see how if you're a healthcare professional, you actually view yourself as the hero and the doula as the challenger. And if you're the doula, you view yourself as the hero and the healthcare system or even the healthcare professionals as the challenger. And that dynamic can be really futile and cause a lot of tension. Talk to us about that. And Maybe talk to both sides because I know there are HCPs out there listening. So if you are a NICU professional, how do you suggest they go about involving doulas? And if you're a doula out there listening, how do you suggest they go about being an active participant in the NICU, but not necessarily inserting themselves inappropriately in that scenario?
Yeah, I see this play out all the time. And because I speak both languages, right? I speak nurse and I speak doula. So I'm hoping to be able to bridge the gap because what my epiphany was like, we are all ultimately on the same page, even though
Team
it
baby.
feel like it. We are on team baby. No one became a NICU nurse because they wanted to cause harm to babies. No little girl was taking care of babies and be like, I want to go to nursing school to force formula. Not there. I promise you as a nurse, I'm not getting any kickbacks with those choices. You take these beautiful dreams and these beautiful aspirations, and then you're put within a system, and the system is the bad guy. But that's for another day. The doula, on the other hand, sometimes I feel like sees the nurses in the medical team as gatekeepers or people who are following protocol or are unwilling to be flexible. What I really want everybody to see is the beautiful gifts that both genres of people are bringing to the care and love of this family. Both pieces are irreplaceable and both of them have strengths and weaknesses. So the healthcare providers have this unique training, these understanding of pathophysiology, of the needs of these really complex medically challenging patients that are in the NICU. But what healthcare providers are often not trained on or have very limited training is on, especially in the NICU, the physical needs of a postpartum family or the emotional needs of a postpartum family. All of the trauma-informed care training that I did was not sponsored by, I never really received that during my entire nursing school, throughout my healthcare professional journey, even as I was stepped into the role of the educator, as I used to do, I was the nurse educator for my unit, so I did all the onboarding for new hires. I started to see like we have big gaps in what we're understanding. So that the piece of that under of those care is what's missing. What the doulas bring in is that big picture thinking. They're seeing the not just the baby and the unique needs of that specific diagnosis. They're seeing how is this baby going to fit into the entire family structure. What are the preferences? They're usually coming in with a history that's much more in depth of what the family went through and what their preferences are and what their dreams are. And they are have the time and the skills to be able to hopefully support the emotional and those physical needs. So what my vision is, my dream for the work of a NICU doula or someone who has the unique understanding of what NICU care is because it is different and having a better understanding allows that language to be spoken between the two groups is that the healthcare team benefits because the emotional and physical needs of the family are being met. And then the doula team benefits because the physical needs of the baby are being met. So in the middle, we have a happy, healthy, connected, supported unit that everybody wins so that the I as a bedside nurse would often feel frustrated because I knew the emotional needs that my family needed, but I would always have to prioritize the physical needs of my patients. So I knew on shifts that I wasn't being able to meet those needs because of the time constraint that I had, all the other logistics of being a healthcare provider, the fact that we are an employee of a healthcare system, so our livelihood and our licenses depend on following certain rules and protocols. Having someone be able, knowing confidently, okay, this doula has got my family, so that the family can show up at the bedside and be able to be present, cared for, and then be able to support and advocate for their own child. And again, decrease the trauma of the experience and bring as much joy as possible. And that comes from feeling supported, loved, cared for, and empowered to know what to do. So everybody's ultimately wants the same outcome. Everybody wants a family that feels confident and safe and a baby that is well to be able to go home together. It's really respecting each other and also opening lines of communication within the safe space of what is appropriate to be shared with a medical team. And also doulas knowing that you don't need to know every detail of the baby's medical care to be able to be an incredibly supportive and impactful presence in that family's life too. So I think if we can do this right, the those statistics that 70% of NICU families have some type of a PMAD, that enrages me. I think that's so unnecessary. So if we can do it right, I feel like that number will drop down to what a normal level is. And it's again, it's not going to take away the hardship, but we can make it so much better than it currently is. And it really comes from putting our egos aside, respecting each other, assuming positive intent always, even if it's not coming off as positive intent. If you assume the person, even if they're speaking with you in a way that you don't like, is not doing it because they're a bad person. Sometimes people are bad people, but most of the time they're a good person having a hard day or a good person in a really intense, stressful situation that their body is responding in a certain way. You're going to get to see the real magic of what my vision of NICU care could be. And I think doulas are the missing link to it all.
I love that. Okay, can you imagine a day in a world where every single family is provided a NICU doula and that's just like part of the care that they get?
I know. That's my dream. Like, I'm here to make a true NICU revolution. I think that if we do it and we do it right and respectfully, because as you alluded to, the NICU environment is different.
Yeah.
It is still, NICU stands for Neonatal Intensive Care Unit. It is still an ICU. So the environment is very unique and it has nuances that a doula needs to be aware of and respectful of and collaborate within that space and do the work within a safe way. The power that that could be is just incredible. I mean, we know instinctively that this is what families are craving. And when they talk about feeling unsupported or even that transit, especially that transition to home too, when they feel so alone and people assume that they're fine, that they got through the NICU and that everything's good now, you're home, you should be normal and grateful and your baby's normal now, it's fine. That is not the experience that most NICU families have, even if their baby was in the NICU for 4 hours. So having someone like a NICU doula that can follow the family throughout the trajectory and continue that continuity of care that is missing in so many families' NICU experiences, those long-term outcomes would just, I'm excited to do research. I'm already involved in some research on the support of doulas in a transition to home. And we know instinctually what the numbers are going to say, but I'm excited to have like actual new evidence to be able to support the potential impact that this role could have in a NICU setting.
Oh my gosh, okay, I can't wait for that. I'm a data nerd and I love hard numbers. I love being able to say, see, this does work. This is why our families need this. Okay, you talked about like the nuance of the NICU is different and it is an intensive care unit. What do doulas need to know about the boundaries of being in that environment and how they can be there and be present, but not overstep those boundaries, not overstep their role?
Right. I think there's a couple different pieces of it. One, again, is knowing that policies and protocols in the NICU were written from a place of positive intent. They're written to protect the baby. So limiting visitors at the bedside, having strict visiting hours, things like that are because these babies and the babies, not just maybe the one you're caring for, but the babies around them are extremely immunocompromised and vulnerable. And physically limiting the number of people in a space is going to decrease their exposure to different germs. So that is one reason why there are limitations sometimes to how many people can be at the bedside at a time. Ideally, families that are in a family-centered care environment, which family-centered care is a very buzzy word in the NICU, and a lot of NICUs will say we are family-centered care on paper, and then in practice, they're like, we have one chair, and it's very uncomfortable,
Oh.
and you can't sit in it because you just gave birth and you have stitches and you don't feel comfortable. So that's a whole nother piece of the puzzle. But really being mindful of your physical presence in a space is one step. Like the baby's hands-on care. Sometimes I'll teach a class to doulas and they'll be like, okay, they really want to help with the hands-on care of the baby. But that is really not where a doula in the NICU can shine because the NICU, as we said, the NICU parents really need to be prioritized for getting their hands-on time with the baby as much as possible because it's just a different environment. So that's one space that I see doulas sometimes feel like That's where they should be, is doing some of the hands-on care, getting the baby out to hold. But in order to do all that safely, you really need to have a confident understanding of the medical equipment and those that brain. What are the benefits and what are the risks? And similar with offering advice or helping a family advocate is doing it through a NICU informed doula lens. If you don't feel confident in the evidence behind why something's being offered or shared with the family, be thoughtful about how you're speaking to your family about it. So if you are, we'll go back to the example that I used yesterday about adding calories to breast milk, which is often used with formula. If you go in the space and say, Mom said no to formula, because that is maybe what your birth plan was if you had a well baby and that was your plan for care is you didn't want to have formula, know that it's different in the NICU. So making sure that you're helping families feel confident and informed and but not confused by, okay, my doctor said this and now you're saying this. I don't know how I feel. So you want to make sure that you're giving the family the voice and the confidence to speak up and advocate for themselves, but you are not doing it for them, really. They need to be able to feel like they're making their own informed choice and that they understand, again, going through yesterday or the talk that we had where we are talking through the brain kind of acronym, making sure that they feel confident in stepping up and advocating, but we're not taking away their power basically by doing it for them because they're already having that feeling in the NICU by definition.
Which is similar to how we do in labor, but we do toe that line a little bit more of, okay, you don't want this, it's your right to decline. Just tell them that. Whereas using the example of formula, instead of saying just tell them you don't want formula, it may be a little bit more of a conversation where have you asked your care team why they want to do this? Have you asked your care team about the risk that you are concerned with? Have you talked to your care team about what your intuition is telling you? Have you asked them the question, what other information do I need to confidently make this decision? Whereas I think in labor, especially with straightforward, low risk, low intervention labors, a lot of us default to you don't want it, you don't have to have it, which is probably still true in the NICU, but there's a lot more nuance to that conversation because we've got this really medically complex and sometimes even medically fragile child at play, right? So it's more of a conversation. So I really appreciate you bringing up the point of even with the best intentions, you can sometimes overwhelm your families by making them feel confused on what the actual right choices or maybe even what their options are because you just don't understand enough. And I'm saying that out of love. Look, there's so many gaps in a lot of our knowledge, you guys, and that's why I have these conversations. That's why I have people like Mary on to help bridge those gaps for us because I don't know of any doula training that talks about NICU awareness. I don't know of any doula training that talks about what it's like to support someone in the NICU or what you can expect in the NICU. And so I think it's not your fault that you have this gap, and it's obvious why the gap exists. But regardless, we have a gap that as doulas, we have to close within ourselves and with our own knowledge gap in order to better support our families for sure. Okay, so Mary, are there tips that you can give us as doulas to communicate with our NICU staff that will maybe establish us as a well-informed doula, but also not put our NICU staff on defense as if we are trying to come in and take over? So one of the things that I do in a labor room is I set my stuff down, I carry this backpack with me, and I will wash my hands, and then I go and introduce myself, or not introduce myself, but I say hi to the family, like, how are you doing? You're doing amazing. I'm just going to go introduce myself to your nurse really quick. I'll be right back. And so it is my way of reaching out to the nurse to say, hey, I'm HeHe. I've been working with this family for about 8 months now. We've been working together for a very long time throughout their whole pregnancy. I wanted to let you know I've been a doula for 10 years. I'm a frequenter at this hospital. If you need anything, please don't hesitate to ask me. I'm here to help you and make your job easier, but But also, if you find that I'm in the way, I don't want you to hesitate to say, like, HeHe, move. You're kind of in the way. So you guys use me as you need in the room. I'm going to be here to help you. I'm going to be here to elevate their voice. I just wanted to reach out and let you know what my name is and why I'm here. And I'm super excited for this birth. Like, this couple is awesome. I can't wait to work with you. That's probably not the conversation you're having in a NICU. Things are a little bit different. So, what are we doing as doulas to establish, hey, I'm not a threat. I'm not going to come in here and overstep boundaries. We are on the same team. I would like to be part of this care team.
Yeah, I think the one of the big things that you can do is help model a feeling of safety as much as you can for the family because the family does have to have some level of rapport and relationship with the medical team to be able to learn from them, to be able to support their baby's care, and to be able to navigate the NICU and feel okay. So, the most important thing as a doula is making sure that you are not sharing this feeling, whether you're doing it intentionally or not, of this us versus them. Similar back to that drama triangle. Like, I've got you, family, to protect you from the NICU team, where I've got you. What we really want is to like open everybody's arms and say, I've got all of us together. Like, I am here. I know, like, I would even lead with saying, I know that you are the expert in neonatal care. I am here to support my family's well-being and make sure that they feel as confident and informed in their care as possible. I am so excited to work together. Like, really just opening the door and saying, I see you, I see your expertise and your role in this scenario. I'm acknowledging that unless you are an NICU nurse is also a doula or whatever it is, that you know that they're here to be able to do their job, which is to give excellent medical care to the baby. And then you're also saying, I'm here to deliver my emotional support and physical care to the family, which will then hopefully also make everybody's jobs easier rather than harder. So even just introducing yourself and saying in a calm and collaborative and warm way. If you give off that warm doula energy, the person's going to respond. It's like the idea of be the thermostat, not the thermometer. So you don't want to if someone's coming in, if the nurse is like looking at you like, who is this girl? I don't know. If you're coming back at them being like, I don't know who you are. Like, I know this family. You don't know this family. And then it just, everybody's escalating. You're the thermometer then. You're like reaching up where everybody's at. If you're the thermostat, if the nurse is coming in and be like, I'm a little sketched out, it's because it just takes one weird interaction with the doula to taint somebody's understanding. And to be fair, a lot of NICUs have not had interactions with doulas, period, at all, or maybe one or two, and maybe they were not what they had hoped it was going to be because of different, usually miscommunication is really what it comes down to. That if you come in and you're like, I am warm. I'm excited to be here. I've still got my family's back, but I'm here to bridge this gap of making everybody feel good in this scenario. You're going to see everybody relax and be like, okay, let's do this. Let's step in together. I have had some incredible experiences with doulas in the NICU from those who they really do have the inside scoop on where the family's coming from, especially if the family can't or is having a hard time articulating maybe different things that they're feeling. I've had doulas be able to help me logistically get a baby out to skin. I've had them explain to me like maybe some fears she had around breastfeeding prenatally that I wouldn't have known about, and I adjusted how I interacted with that family completely differently. But it was really like this collaborative conversation. And then I've had a couple experiences before too where I had that kind of like us versus them. And I had to be like, girl, I'm on your team too. I'm a doula. I'm okay. I'm cool. But I felt, if you feel also as someone coming in, you feel in the space that you're already bad just by the badge saying that you're an RN, it doesn't feel good either. Like it's people. Healthcare is people taking care of people. Like we have to remember at the end of the day, it's not blanket stereotypes. We are individual people and just treating people as individual people and giving them the benefit of the doubt and that positive intent set the groundwork for much more open door and collaborative conversation as well.
Totally. I mean, speaking of setting the groundwork, remember that, doulas. If you're going into a NICU, think about, hey, I might be one of the first doulas that this NICU staff has ever interacted with. I want to set the stage. I want to lay a great, healthy, strong foundation. I want to leave them with a really positive, warm taste in their mouth of what doula support can be like. Not only are you making yourself look good, but you're making it easier on the rest of us. It's like when one doula does a good thing, you lift us all up. And when one doula does something bad, you do really take down all of us. And so just keep that in mind. You're not just representing yourself or your business or this family. You are representing doulas as a whole. And I think that a lot of times that can be lost in translation. I'm going to challenge you to just keep that in mind, that even if you just hear my voice being like, girl, you're representing me as he, and you better not. So just keep that in mind. You are representing all of us. And we really do, if we're going to start to be viewed as part of a critical piece of the care team, whether that's an L&D or postpartum or the OR or the NICU, we have to start acting as if we are that critical part. And that includes being respectful and understanding the boundaries and understanding what our role is and really not overstepping those things. Okay, so Mary, what kind of questions should doulas be encouraging families to ask at things like rounds or care updates? Because this is something that's going to happen every day. It's a chance for that NICU team to come in and share updates with that baby. And this is a great way, you shared in the last episode, that parents can be really actively involved in the care plan of their baby. But you shared that a lot of parents are like, I really don't know what to ask. What can doulas be saying? Hey, this is a great question to ask. Hey, this is a great question to ask. In addition to the things that come up between care rounds, and they say, start a notes in your phone. And then these are all the questions, like save that for rounds for tomorrow or for this evening. What kind of things can doulas be prompting families to ask?
Yeah. I love the first thing that you said just now is I always encourage doulas to pre-round with their families. So almost do like a test drive. I'm the doctor, I'm here. Let's talk through what you saw. What did you see with your baby in the last 24 hours as a parent? What are your fears and concerns? Because oftentimes they will ask, they'll say, Mom and Dad, do you have any concerns that you want to bring up? Hopefully they're going to say that and have the words to express what you want to say planned beforehand, because sometimes it can be hard to be like, I don't really know what the word for this breathing fast is or whatever it is. Just help them organize their thoughts and write them down, because if it's all up here and rounds happens, you're going to forget 92% of what you were going to say, and then the doctor walks away to the next bedside and you're like, no. And it's hard to, they'll come back, but it might be for a little bit of time. So having a good outline of what you want to talk about beforehand and maybe written down verbatim the questions that you want to have asked. In terms of what to ask in rounds, if you haven't come up with those questions already, there's a couple different ways you can go. So usually in rounds, they're planning for or coming up with a general plan of care for the next 24 hours. Sometimes what I'll see in the NICU, and this again is going to depend on your client's comfort level and what they do and do not want to know. I also want to make a caveat here that not all families are going to want to or be capable of stepping into this advocacy role. So if you are just like in a birth, if you're seeing a birth happen and you're like, I don't want this for me, but the family seems super fine with everything and thought they had this most incredible blissful birth, you don't want to like dump on their happy time and create trauma where there isn't. So if the family does not want to step into this advocacy role, or they're so overwhelmed and tired and in true fight or flight, acknowledge that this is safe for them. You're doing such a great job. What we don't want to do is make them feel like they're not doing a good job as a parent, because they're going through a different scenario too, and they don't know how their body's going to react under this intense trauma to what they're going to want in the moment. And it can be day to day too. So I did want to caveat that too. Don't be like, you got to do this. You got to do this. Your baby deserves this type of, meet them where they're at. Don't cause more guilt. They're full of it. The guilt is all up here already. But if they are looking for questions to ask, one of my favorite ones, especially sometimes care providers in general, NICU teams too, can almost not dumb it down, but surface level explain what's going on. And if that is something that's fine for the family, that's great. Maybe they don't want to know the details, but if you're someone like yourself and myself, who I'm not okay with just everything's okay, I like to ask, what are you most worried about for my baby for the next 24 hours? What's that thing that you're thinking of in the back of your head? And most doctors will tell you, they'll say, okay, like actually his vital signs were great. Maybe his hematocrit dropped a little bit. I'm a little worried we're going to need a blood transfusion in the next 24 hours. But if you didn't ask that, they're not going to tell you because it's not definitely going to happen in the next 24 hours. If it was, that would be part of rounds. So if you're someone who really wants to start to know the intricacies of what's going on, I always ask like what's in your back of your head? What are you worried about? What are you thinking about? What should I be looking for in my baby in the next 24 hours? Are there any signs and symptoms that I should be alerting you guys about if I observe this that you want to know? Similarly, also, sometimes, especially if it's a newer parent, like what is normal is not always evident because if you've only had a baby and they've only been in the NICU, you might not be able to like have a great grasp of which doulas can help with that a lot too. Oh no, this is typical normal baby behavior. But really getting to know like what that team is looking for, what are they concerned about? And then I always ask, what can I learn about today to help prepare me for taking this baby home? Like what kind of thinking about, even if it's this baby's definitely going to be here for 6 weeks because they were born at 31 weeks or whatever gestational age it is, what can I do today to help preparing for home? Or if you're in rounds and you're listening, you can say, yesterday you were talking about an acronym like TPN. Can you explain to me what that acronym meant? Doctors typically, they usually love to teach. They love to show their knowledge and their expertise. So asking for like little micro lessons on different topics can also be helpful too. But really that my favorite question is like, what are you most concerned about and what should I be telling you about too? Because then that puts you in the role as a clinical provider basically of your baby's healthcare team because you are as we said yesterday, the nurse may have multiple babies and you are maybe noticing little subtle changes, even if it's nothing that's going to be an emergency. A nurse is going to notice those like bigger symptoms. We're watching for them closely. But you might notice some subtle changes that you want to bring up on rounds the next day and advocate for.
Yeah. And doulas, it's okay if they just have the capacity to ask two or three of these questions. Don't overwhelm your families. Don't give them a list of 15 questions. And I think a really great question for just you to ask your family outside of their medical team is, what is on your mind? What
Mhm.
do you want to bring up in rounds? And then you can help tailor the questions to them. And then also check in and make sure that they're feeling heard. Are you feeling supported? Are you feeling heard by your medical team? Because if they're not, you can always give them some tips on simply just opening that communication and saying, hey, we're not feeling super supported. Here are the things that we would like to have. We'd love for you to come to us before you do things, not after you do things. We would love to have a discussion about X, Y, and Z. And we feel like that's not being brought up. Okay, so Mary, how can a doula help support bonding between parents and a NICU baby when there is so much equipment and all these things that are attached to the baby's body and maybe even some emotional stuff going on because of the experience that they're going through?
Yeah, so some of this comes back to being NICU informed, if possible, like learning a little bit about the differences between preemies and term infants. But ultimately, one of the most important things that we can do for families is make them feel and know that, again, what they're able to give in that moment is enough and that their presence, their physical presence is healing. In terms of logistical things, I, as a doula, actually would carry scent hearts in my bag. So if the NICU didn't have one to provide, or there was any type of separation for whatever reason, whether it's a C-section and the baby had to go to the warmer for being monitored for something and they couldn't do all those different things. And I would say I would have those scent hearts ready to go. You can go to a fabric store and cut out a couple and put them in plastic baggies. Super simple, but really it's a nice little gift to have too, even at home too. So something as simple as sharing. Your baby knows your smell. Your baby knows your voice. Your baby knows your touch. You are so special to them and they love you so much. You did such an incredible job. You brought your baby earthside. You are the parent that this baby is meant to have, and this baby was meant to be your baby. And you're going through this together, and I've got you. In terms of logistical skin to skin, it can be helpful That's a question that you can have if the family is really ready and excited to do skin to skin, is having them ask the team, can we do skin to skin today? Sometimes it is because for some babies, it is a logistical puzzle that needs to be solved to make sure we're doing it safely. Sometimes asking the question will help to start getting the plan in place, whether it's can't happen in this exact moment for whatever reason, from safety or equipment, or something needs to be changed on the monitor to make it happen. It starts the ball rolling. Okay, the family's really interested. What can we do to make this happen as quickly as possible and as safely as possible? So just even asking daily, what can we do today? In order to advocate for skin to skin, also, I always encourage families, if this is a longer NICU stay or like beyond a day or two, even call before you come in, say what time you're coming in, and say, hey, I'm going to get here at 10 a.m. I would love to pump, and then can we do skin to skin after the 2 p.m. care times? That is such a gift to a NICU nurse because I can plan for that. I can have the chair ready. I can have the pillows. I can talk to the respiratory therapist and say, "Hey, can you block 2 o'clock because this family's coming in and wants to skin now?" It can be challenging to have someone come in and then say, "I want to skin right now." I mean, for a well baby, we can make it happen, but for those more complicated itty bitties that have tubes and wires and all the things, you want to make sure it's safe too. So making sure that, again, that communication is open and clear and that families know that they can ask for things too. But sometimes it's just having that neutral person telling you over and over again that you are enough, you are doing as incredible job, and that the NICU is just the beginning. So you guys are going through a hard thing together, but I see the incredible parent that you are, and your journey beyond the NICU is going to be beautiful as well too.
Something that I see a doula can fill in beautifully is just setting that expectation, right? So if a parent says, I'm just going to go up this morning and have skin to skin, it may be helpful for you to say, just so you know, it might be helpful for you to call ahead and let them know what time that you're going and ask them if there's an RT, a respiratory therapist, that's available, or ask your NICU nurse if there's a time that might be better for you to come up so that you can have skin to skin. That way, you're preventing that emotional disappointment in your
Mhm.
family by arriving at the NICU and they say, oh, our RT is not available until 2 p.m. for NICU, or actually, we can't do skin to skin today because of X, Y, and Z. You can prevent that in your family by just setting those expectations by exactly what you said, Mary, having that NICU awareness, knowing the things that your parents going through the NICU would not know. It's that insider information that I feel like doulas are so good at. Okay, along the same lines, how can a doula help facilitate and advocate for feeding goals in the NICU, especially because we know, and we discussed in the last episode, feeding a NICU baby can sometimes be really different.
Yeah, so one of those things, as just like with skin to skin, is helping families come to terms with the reality of the setting that they're in and help them adjust their expectations and create a new plan that feels aligned to them with the scenario that they're in. One of the biggest places, especially if you are a birth doula, is setting up those early pumping experiences and making sure they are as good as possible, making sure that they're using the right flange size. They understand how to use their pump, like really understand how to use their pump, that you're not just setting them up and saying, and maybe the first time that's fine because they're going to be doing all the things. But the pumping is a big part of a NICU journey for a family. So if you are not comfortable with how to use a pump, I would take like a little bit of time just to get the general idea of how to help set a pump up in the NICU. The nurses are usually there to help. The lactation consultants are there too, but it often, especially if it's a more urgent or emergent birth, that's something that can fall through the cracks. Helping them logistically prepare themselves to be able to offer breast milk if that's what they want to do. And then sometimes also because pumping can feel so sterile in a way, is trying to, I have a whole thing of like how to make pumping suck less. Like how do you make that experience feel as good as breastfeeding could feel for that family? So sometimes I've had doulas share that for a family that is in a NICU experience, they're recovering in the postpartum room, they'll bring a warm beanbag or a warm towel and put that feeling on the family's chest so it can have the feeling of having a baby on them while they're skin to skinning. Having the scent hearts, playing calming music, making sure that they feel clean and feel good about their body, because there's often sometimes, again, that feeling of my baby's in the NICU, it's my body's fault or whatever nonsense that we feed ourselves as parents. So just helping them have the logistical most positive experience possible. And then also, again, giving the family permission and words to be able to advocate for themselves for their feeding preferences in the NICU setting. But if the family is sharing, I want to breastfeed, but no one is helping them with the logistics of how they're going to make that a dream a reality within the meeting the needs of the baby as well, then it's not going to establish them for long-term success. So as much as we can help families be like, I know this is not what you envisioned. You wanted to have this baby on your chest, skin to skin immediately, and you wanted to have that breast crawl and those early breastfeeding experiences be here. Let's make this as good as possible and comfortable as possible and come up with a plan for pumping that feels good, that allows you to rest, visit your baby, and still start to establish milk together so that you have milk to offer your baby when everybody is ready to go. And so, again, it's not going to be the doula coming down the hall and saying, don't give the formula, the family doesn't want formula. It would always be having the families have conversations, and you can share that if someone's, oh, I don't think she cares, and you're like, no, I actually, we had this conversation. I know that she would prefer that. Do you mind calling them and having a conversation about what the next steps are for feeding for this baby safely? That would be an appropriate place to talk in, but really helping families with that tangible postpartum needs that they have that no one is meeting really beyond themselves because there's no one there to do that. But doulas can.
I love the doulas are such a good bridge in that gap. Okay, I think you saying like tangible postpartum support leads me to my last question, and I think this is a great place to wrap up. But you have mentioned multiple times in this episode about discharge and that families often feel just dropped in discharge. And I don't know that it's anyone's fault necessarily. I mean, it's not like any of us expect the hospital to follow us home. We know that's not part of the US healthcare system. No one's expecting a NICU nurse to come out and visit us. We know that's not part of the US healthcare system. We're not even expecting to have anybody really call us. We know that is where we're at with the US healthcare system right now. So, as a doula, how can we bridge that gap of the really intensive care that you had in the hospital, always having someone there, always having someone available to answer your questions, having this large team always there to support you, now going home and transitioning to a place where it's literally just you and your baby, and you still have some of this residual trauma and probably second guessing yourself on a lot because now your baby has this label of being a NICU baby. What role does a doula play in that, and how can we best support families in that discharge and transition home process?
So much to unpack here. One thing is to know that most families post perinatal mental health symptoms actually do not show up until after discharge. So once they're out of that fight or flight zone and their cortisol drops is usually when they're starting to see symptoms. Only 25% of NICU families who have clinical PTSD experience it in the NICU. So that's 75% of their PTSD symptoms are showing up after discharge. So if you're working with families, say you're a postpartum doula in their home, you should, I always prepare families that these are things that you might be experiencing, and then having some type of a contingency plan or already a plan in place for who and what we're going to do, whether it's calling Postpartum Support International, already having a therapist in place, because oftentimes it's when things get quiet that those feelings really start to come through. Another thing that I think of with postpartum NICU families, again, this depends on their length of stay, but a lot of doulas have read the book, like the first 40 days, where you're imagining there's this period of time where the family, the birthing person, and the baby are really regrouping, bonding, connecting, and healing. So there's a piece of the first 40 days I feel like is like consecutive days post birth, like the physical changes that are happening, the NICU doesn't delay those at all. They're still going to be happening. But even if the baby is in the NICU for months, I feel like there's a certain, I in my head, I say it's day 20, but that's very, it's halfway through. That does not start until they go home. So they need and deserve to have that same type of nesting experience at home, whether they're bringing home a chunky 5-month-old or they're bringing home a baby that is still very freshly a newborn. They are reintegrating. They're basically being released from an institution and being brought into the real world. And so they deserve to have uninterrupted times of skin to skin. They deserve to have postpartum nutritious meals and people caring for them and helping them with the logistics of their life so they can really bond and connect. So if you are a doula, I would always, if you can, set your phone for an alarm to always check in at the discharge mark and then check in like a month or maybe even 2 months or 6 months after, because that's sometimes when the freezer is no longer stocked with food, but you're still dealing with this basically brand new baby that you are bringing into your space. And if there's other siblings, you're navigating what it's like to have a baby at home. So, really remembering that they're still very freshly postpartum. And another mentally, whether or not they're physically postpartum, their new role switch is that same type of timeline that they would have had however many days or months or weeks before that. And some families that I work with in the NICU, the other thing is that like the NICU stay can be traumatic, but there's more traumatic or dramatic births that are associated with a NICU stay. So a lot of times families that are in the NICU, they did not give themselves any time or space or thought to think about their birth. Whoop, packed it up, sealed it up, put it wherever in their brain, and they can't think about it. But oftentimes those memories and experiences, they'll have time, space to start thinking about them. So if you were a birth doula that was able to be present in their birth, they may be ready or want to have a birth debrief much further out from their NICU stay. So even just popping in and saying, "Hey, do you want to tell me your story? Do you want to talk this through?" can be really healing. And some families also benefit from a rebirth ceremony where you recreate the experience that they wanted to have with their baby, whether it's like certain music that was playing, or maybe you're in a space with twinkle lights and you have this almost like ceremony of rebirthing to allow them to reset their buttons, reset the baby's buttons, because the babies are having their own lived experience throughout the NICU too. And they bring some of their own sensory experiences, not necessarily trauma, because I don't like to say a baby has trauma because that's very hard to register with the family, but they lived it. So they also are coming home and reintegrating into a brand new space and a new environment, new smells, sensations, and so giving the family a lot of grace or permission to feel a lot of grace for themselves and also the logistical support and acknowledgement that this is really sometimes for families where it can feel almost harder because they're looking around. They're used to being able to ask people, "Oh, what do you think about this poop?" Or "What do you think about their breathing?" Or all these other like little micro questions that happen. All of a sudden, there's no one there around them. So if you are someone who is postpartum and in their home, also having an understanding of the nuances of what makes NICU babies different can help you be able to help build up those confidence muscles that a lot of NICU parents lose in the NICU because of just the nature of the setting and the steep learning curve that they had.
Yeah. Oh my gosh, Mary. I said it in the last episode, but you are just absolutely brilliant. I love that you have both perspectives. You understand the doula role and you're able to understand that medical perspective too, and that you share in the same goal that I have is to bridge those two things. I think in especially in the medical climate that we have right now, it is often us versus them. And if we continue on that path, we are going to destroy our healthcare system. There is no end in sight when it's us versus them. However, if we can do it right, just like you said, and we can bridge the gap between our families and the healthcare system, and our doulas being incorporated, and our healthcare professionals meeting families and doulas where they're at, we can really, I think, produce this very symbiotic, like beautiful relationship that everyone wins. Our healthcare professionals are respected, our families feel really heard, and the doulas are part of that care team and looked upon as a respected piece of the whole team that helps us improve outcomes for our moms and our babies and our families. And I just love it so much. So it is almost as if we should have a certification program for this. Tell us about how you support doulas in becoming NICU aware and learning how to navigate the NICU and becoming certified as a NICU doula.
Yeah, so one of the things that I realized as I started working as a doula, which I actually did my first doula training in nursing school, long story, I've been doing this for almost as long as I've been a nurse, was that, as you said, very little NICU information is given to doulas, even though doulas are the boots on the ground support for families throughout the trajectory of pregnancy, birth, postpartum, and beyond. And so by not having this information, we're basically gatekeeping doula care from NICU families, which is just, these are the people that truly need this type of support the most. And I also feel like having more NICU-informed doulas in a space will decrease healthcare burnout too, because that's one reason why healthcare professionals are doing what they do is because they're burnt out. So everybody wins. But I created a program called NICU Doula Academy, which is the first NICU Doula certification program. It is a 10-week training. It is a live cohort. So one of the most exciting things about that is that we're learning from each other and we're really creating, because this is a newer role. We're figuring out ways together and building relationships and networks to be able to bring this work into NICUs all across the country and world. And it is approved for 30 hours of continuing education through ANA, which is the American Holistic Nurses Association. So I have nurses and other healthcare professionals also going through NICU Doula Academy to bring doula care and doula lens through to their bedside care as well. So it's a place also where we're meeting all these people who in their gut know that NICU care needs to be better than it currently is, that there are these gaps and are these people that are stepping up saying, me, I want to help fill these gaps. So I'm so excited to keep graduating new students and bringing this work into the world. And because everybody's bringing their own lens and understanding and background and skills and want to use this work in different ways, because the NICU doula role is unique in that it isn't birth only. It's not postpartum only that you can, a NICU doula can support a family for that full spectrum of time, depending on your strengths and interests. It is so exciting. And for doulas that also maybe are not ready to be fully certified, but really are ready, really are listening to this and be like, I want to know the foundation and have a more in-depth understanding of how to support my NICU families. I have a shorter self-paced course called Navigating the NICU for Doulas, which gives you those foundational understanding of how to, like what day-to-day in the NICU looks like, how to create a good schedule for your family that feels aligned for them, how to support advocacy and empowered parenting, breastfeeding, all the different things to give you that foundational so you can be a NICU-informed doula.
I love that so much. Doulas, was this not the most amazing episode ever? I know so many of you are like me out there and you want really desperately to be this full spectrum support. So no matter what unfolds or what transpires in your client's experience, you're there and you're equipped and you are educated and you're informed and you're able to provide them with that support. But I also recognize that sometimes we have our own knowledge gaps. Sometimes it's really hard to find information on how can I best show up for this family? Where do I get evidence-based information and education on this piece of the healthcare system, whether it be the NICU or the OR or a prenatal admittance where you have to be in the hospital. So many trainings only teach us this very narrow view on what it's like to be a doula and specifically birth doula. And so I wanted to empower you and equip you to broaden your horizons, to have access to more information, and to make you more confident for something that inevitably, if you are a birth doula, you're going to run into the situation where you have a family that has a NICU stay. And I do not want you to be scrambling in your own self, being like, I wish I could show up better. And I don't want you to leave your family feeling abandoned because you didn't have any tools in your toolbox. You know that my ultimate goal is to help equip you with with your biggest and best, most robust toolbox ever so that when you need it, you can dig deep, you can pull those tools out, and you can show up for the families that you serve in the way that feels best to you and supports them in the way that they need. So thanks for everyone for showing up today. Mary, if people wanted to connect with you, join your program, learn from you, how can they do that?
All the information is on my website, which is the NICUtranslator.com. I also have a free resource there called 5 Things Every Doula Needs to Know About Caring for NICU Babies and Their Families, which gives you some 5 really tangible things that you need to know just to be able to understand the basics of supporting families. And then I'm also on Instagram at the NICU Translator, and I have a podcast if you want to start building your NICU education skills now called the NICU Translated.
I love it so much. All right, doulas, don't forget that your role doesn't end when that baby pops out. Sometimes we need to support families well beyond that moment, and sometimes it looks a little different than even what we had anticipated. I hope you guys enjoyed today's episode, and I'll see you in the next episode. Be sure to follow Mary on social media, and you can find me at Tranquility by HeHe and at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye. Thank you so much for tuning in today. I love hanging out with you, and it is an honor to be your go-to gal when it comes to preparing for your baby. If you've enjoyed today's episode, please leave a 5-star review and tell others why they should be listening to the Birth Lounge podcast too. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent without all the trauma that you so commonly hear about on social media. New episodes air every Wednesday and Friday. Hit that follow button so you never miss an episode. I'm HeHe, and this is the Birth Lounge Podcast.